So this is Dr. Adam Fazio, and I'm going to be walking you through some common mistakes that guys make in their recovery after penile surgery. And many of these surgeries have common sort of elements in terms of the recovery, and guys commonly run into some similar issues with the recovery. So we're going to review those quickly today to give guys a better idea of what they want to avoid after surgery. Most of our restrictions for patients after penile surgery are aimed at avoiding wound dehiscence, that would be the wound coming undone, or bleeding. So those are the two primary complications we're trying to avoid with postoperative restrictions. Wound dehiscence is really only an issue for those penile surgeries that involve an incision on the penis itself. So here I may be talking about surgery for Peyronie's disease. So a guy with a curvature may end up with an incision on his penis. Circumcisions, frenulectomies. These are my most common procedures we perform here in our office surgery center, where guys would end up with an incision on the penis that requires some care. This is pretty easy to avoid, honestly, in terms of the wound dehiscence. The primary restriction a guy's gonna have to avoid is sexual activity, masturbation, intercourse, sex of any sort, because this puts tension on the wound. This one's pretty obvious and pretty apparent. Patients always ask about erections. How do you avoid erections? How do you avoid tension on the wound during erections? It's impossible. There's nothing you can do to avoid that. Billions of dollars are spent each year researching how to give men erections. No one spends a single dollar researching how to take them away. So we don't have a great answer for this one. There are a variety of medications we will trial if guys are having uncomfortable or painful erections with variable efficacy. So I always have to experiment a bit with my patients. At the end of the day, we kind of have to accept that there will be some intermittent tension on the wounds because of erections, but otherwise the primary thing to avoid is going to be sexual activity after surgery. In terms of bleeding, bleeding is going to be controlled intraoperatively by my technique, taking time, making sure that any apparent vessels that want to bleed are controlled while I'm operating. Postoperatively, I typically leave a bandage of some sort around the penis that's compressive in nature, so for the first 24 hours after surgery, that compression is going to help prevent any bleeding. There still is a bleeding risk for around 2 weeks after most penile surgeries, and the primary thing that would provoke or bring on bleeding is going to be any heavy activity, and primarily anything that involves lifting or bearing down. So we think about weightlifting, exercise, bowel movements, all things that can cause a sort of temporary or transient increase in pressure in these small vessels in the penis and cause a bleed. The penis is especially prone to these bleeds because the skin is very stretchy, very expansile. It has high capacity. It's unlike other areas of our body. If you get hit, you develop a bruise, right? The bruise is just a bleed under the skin. There's nowhere for that blood to go. Pressure builds up pretty quickly, and the pressure in that hematoma is going to overcome the pressure in the vessels, and it stops. The penis is meant to expand. There's a lot of room for blood to accumulate superficially, and so you can get a fairly large hematoma or collection of blood because of those activities. So no heavy lifting. I always tell patients 25 pounds or so for 2 weeks after most of my surgeries. There are some where it's a bit longer. Aside from heavy lifting, the other one here is going to be exercise. So I don't want guys doing any running. And aside from that, avoid constipation. Guys are sitting on the toilet bearing down, if they have not had a bowel movement in a few days, can significantly increase the pressure in those vessels and cause a bleed. So if a guy is prone to constipation, I'll have him increase his water intake or start a medication like Miralax postoperatively. Another common issue that guys face after penile surgery, I don't want to say complication because this is not really a complication, this is just a very common issue that happens secondary to surgery, is swelling or edema. Swelling or edema is just going to be a collection of fluid within the tissues themselves. This is distinct from, say, a seroma, which is free-floating serous fluid between tissue layers. This is fluid that's collected within the tissues themselves. Very common after penile enlargement surgery, after circumcisions, after frenulectomies. There are a few things guys can do to either eliminate or at least alleviate some of the swelling postoperatively. So initially, the compressive bandage I place really does help prevent that swelling early on. Another thing men can do after they remove their compressive bandage is position their penis appropriately. So the penis is a dependent organ, tends to hang. It wants to collect fluid. So while guys are at home, at least, I ask them to elevate their penis. So either roll up a towel and put it under it to create some elevation to encourage that fluid to drain back, or to put it up under the band of your underwear. I know it's not the most convenient thing to do at work, but at least while you're home, some elevation really does help avoid that swelling.